last 3 years, I've been working with Dr. Moeller and at Elan Implant Center, and I am very passionate about what we do because we are changing people's lives. One of the things that I think is most beneficial as me being in the position as a treatment coordinator now is that I know exactly how the procedures work during the surgery, exactly what goes on, and I'm able to correlate and communicate that information with the people who want to come in and see me during a consultation. So if you have questions about the surgery, it's very normal to be nervous. It's very normal to have lots of questions, but I'm able to answer all of those questions for you, whether it's questions in regards to the surgery and the sedation or questions in regards to the bone grafting, implants themselves, just the time frame is another big question that we get. And then just how we're able to customize things to your liking, but also just the perfectionist eye that Dr. Moeller has into making sure that things function the way they need to. You can always call us and talk to one of us at the front desk here, whether it's myself, Shannon, or Erica, and schedule a free consultation. Or you can also go to our website and schedule a consultation through the website. So when you first come in, you're going to go over to the front desk, and then things will be, you'll have paperwork and things that we need turned in ahead of time. I will be the one that will come in and grab you from our waiting area. From there, we will start by doing some imaging, a pano and a CBCT. This room is most important for sure before meeting in our consultation room. We start by taking a pano image, which gives us a full spectrum of your mouth. And then after that, we do a CBCT imaging, which gives us three-dimensional imaging that we can look further into the bone structure to make sure that there is no deeper concerns going on, rather than just the outward images that we see from a pano. That way we are able to get a better idea where you're starting at and where you're at and what your goals might be. At that point, all of your images are uploaded to your chart. Dr. Moeller then will look over all of those images before he comes and meets with you and to address any concerns that he might have that's not already been addressed or brought up. And the consultations are free along with a pano and CBCT. They're all included. And then we go into our consultation room. You can feel more comfortable and at ease to be able to communicate and talk about the things that you're concerned about or what brings you here. So this is our consultation room that we like to meet in. It provides some privacy to the patient where they can feel more comfortable to discuss what they have going on, any concerns that they have going on. Most of the people that we meet have a lot of anxiety from either past dental trauma, a lot of anxiety in regards to even maybe some embarrassment of where they are. We can understand that, so we want to provide a safe and friendly environment just from the get-go. Then we're gonna talk about what are your goals? What are you looking for? Is it a single implant? Is it a couple of implants? Or are you looking for a solution for a full mouth? And that's really where we come in and specialize in, is full mouth implants. So what we specialize in is called All-in-X. We place full mouth implants, typically between 6 to 8 implants per arch. So we place 6 to 8 implants on the upper arch and 6 to 8 implants on the lower arch. We can do one or the other, depending again on what your needs are and what you're looking for. One of the best parts about us working with us is that we actually offer full sedation surgeries. During that surgery is where when we'll extract all of the teeth, we'll place all of the implants, we'll do bone grafting and any tissue grafting at that time. You don't necessarily go home that day with teeth, but the next day you come in, you will get your first set of teeth, or what I like to refer to as the rough draft of your teeth. It's just the starting point. We're able to customize everything to your liking, and to your 1-week appointment where we just evaluate your tissues and make sure you're healing properly, and doing updated scans so that we can provide you at your 2-week post-op a new set of teeth, but you're gonna heal in for 3 to 4 months, just depending on how your surgery goes. Everyone's situation is different. So after the 3 to 4 months of healing, you come in for what's called an initial scan appointment. It is a longer appointment, but at this time, we're getting updated information and collecting updated data of your tissues and how they have healed, how they've settled. We're also collecting data on your bite. There's a lot that goes into the structure of your face and your speech. So we're making changes in that at that time. We're customizing things like your shade, if you want them brighter, if you want them more natural, if you want them longer, shorter, more squared, rounder, able to customize them. But we're also looking at its function. How's your speech? How are you chewing things? Are you biting your lip? Are you biting your cheek? And those are all the things that Dr. Moeller really has that eye for in perfecting your teeth. And at that time, after that appointment, you will actually get your healers back in, and your next appointment, you will get what's called your first try-in. So these, at this time, we're doing more try-ins and different prototypes depending on if we're making changes or not. So if we're making changes, the last thing we want to do is go into your finals because even the smallest changes sometimes can make the biggest difference. And if we love the try-in, that set of teeth, then we'll go to your finals. The final delivery, we're either giving you the PMMA material or giving you the zirconia. At that time, we give you all new screws that we use to place your prototype. We also place composite fillings into all of those access holes, so everything looks seamless and you're happy with your outcome. We actually have our own in-house lab. So we make all of our own implant retained dentures, we make our own dentures, we make our own crowns, bite guards. We also make what's called a surgical guide. So the surgical guide is something that our lab will create between 3 shape in mouth scans and our CBCTs that will help for Dr. Moeller to place those implants in the most ideal place so that you have longevity for those implants, stability with good bone, and to make sure that everything will come together nicely. We typically see, that people think that maybe their age is going to help or is going to prevent them from being able to do something like this, but really it's more common than you would think. And I really want to break that stigma, the stigma that we see people from all ages, between their 20s all the way up into their 80s, and everyone can apply. And I think you'd be pleasantly surprised to see that the cost is doable, and it is something that is achievable for a lot of people. And we do offer financing through Elan Implant Center with several different companies that offer financing. And we can, here in the office, actually pre-apply. So it's just a soft pull that doesn't affect your credit. We are able to apply to see if you're pre-qualified for an amount that would help cover the cost of the All-in-X. And a lot of people find comfort in knowing that we do offer the full sedation surgeries with our CRNA, where we are able to get everything done at that time. And it just provides that peace of mind for a lot of patients. After we've had the discussion about the All-in-X case, and we were able to get you some financing or able to find that you were ready to move on with the All-in-X, what we'll do is get you scheduled for all of your appointments to get you started. So we'll get you scheduled for your pre-op appointment, we'll get you scheduled for your surgery day appointment, your next day, your 1 week, and your 2 week. And then, each appointment, Dr. Moeller is involved with at every point of your process.